What are the ABCs for hypothermia assessment? Imagine you're out in the cold and someone starts acting confused or shivering uncontrollably. Knowing what to check first can make a big difference in saving their life. That's where the ABCs come in. The ABCs stand for airway, breathing, and circulation. They are the first steps to evaluate in any emergency, especially with hypothermia. Start with the airway. You need to make sure it's open and clear. If the person is unconscious or semi-conscious, their tongue or vomit could block the airway. Gently tilt the head back and lift the chin to open the airway. If they are not breathing or have irregular breathing, you may need to do rescue breathing or even intubation if trained. Remember, hypothermia can depress the nervous system, making airway management more critical. Next, check their breathing. Look for chest movements, listen for breath sounds, and feel for air on your cheek. Breathing might be slow, shallow, or sometimes stop altogether in severe hypothermia. If they are not breathing or breathing is very weak, give rescue breaths. Do not try to correct blood gases for temperature at this stage. Oxygen can help if you have it available, especially if the person is breathing but their oxygen levels are low. Then move on to circulation. Feel for a central pulse, which is usually found on the neck or wrist. Take at least 30 seconds to check because hypothermia slows the heart rate and makes the pulse weak or irregular. Be gentle when handling the person to avoid triggering dangerous heart rhythms like ventricular fibrillation. If no pulse is felt, start CPR immediately. Continue until help arrives or the person shows signs of life. Other important points include not assuming death if the person's pupils are dilated or if they have no reflexes. These signs can sometimes be reversed with proper treatment. Check for other injuries like frostbite or trauma. If possible, measure core body temperature with an esophageal or rectal thermometer, as peripheral thermometers may give false readings below 34 degrees Celsius. Assess their mental state. Are they shivering, confused, or unconscious? This helps determine how severe the hypothermia is. Handle the person gently and avoid unnecessary movement, which can cause heart problems. Remove wet clothing and insulate them with blankets or clothing to prevent further heat loss. Finally, get them to a medical facility quickly, especially if their core temperature drops below 28 degrees Celsius or if they are unstable. Knowing these ABCs helps you act fast and give the best care possible in cold emergencies.